are people. So just think about it.
There's no stigma or discrimination against the heart, the liver, the kidney, even the gallbladder. Doesn't even have a job.
Yesterday, depression was kept in the dark.
And bipolar disorder was your best friend's mother's problem.
But the tide is turning.
We're stopping the stigma.
We're coming out.
Our goal is to make the discussion of mental dis-ease cool and trendy.
No kidding?
Me too.
No kidding.
Me too.
No kidding.
Me too.
It's time we gave the all-American brain some peace of mind.
Living with mental illness is a challenge, but it makes me stronger.
Some would say I'm crazy. I would say I'm enlightened.
Some would say I have a disability. I would say I have special abilities.
Some would say I'm far from ordinary. But I'd say I'm extraordinary.
1 in 4 adults are affected by a mental illness.
To learn more, visit oneinfour.info.
Welcome back to Seeing the Need, Finding the Solution. Some very important issues in our valley, talking about mental illness, talking about substance abuse, talking about a lot of different stuff with Magellan Services of Arizona and People of Color Network. Tomas, touch on some points I know you wanted to talk about in break, and we'll lead you into our next guest.
Great, excellent. Yeah, I wanted to just kind of talk about what's been building up to this whole health focus and this health and wellness initiative that Magellan has taken the lead on, and joined by all the networks and providers and partners in the community. And back in 2009, we had worked together on a suicide prevention and intervention initiative, and really trying to make sure that we provided training and to physicians and nurses and clinicians and case managers out there to help identify those that were at risk for suicide thoughts and actually acting out, and then making sure that they were connected with the intervention and support they needed to help them through that crisis. The other initiative and effort was that Magellan joined forces with partners in the community to implement a tobacco-free campaign program, and we partnered with the Arizona Smokers Helpline and the ADHS Bureau of Chronic Disease and Tobacco Cessation and other providers, and to implement programs to help people stop smoking.
And it's funny, 75%? Yeah. Was the number of people with drug addictions? 75%. I saw that because I'm one of those 75%. But it was 75% of people that have had an addiction usually smoke. And I've been afforded sobriety for a number of years, and boy, that was harder than anything, was that tobacco. So hats off to those accomplishments. Go ahead, Tomas, again.
Yeah, and then following that in 2010, Magellan introduced the Whole Health Peer Support Program, and supported by a grant from Substance Abuse and Mental Health Administration to put wellness support groups in the clinics that are available throughout the provider network organizations. And so that focus on prevention, on physical activity and healthy eating and active living and medical issues begin the path and the focus on where we're at today with the health and wellness initiative led by Magellan and supported and joined by all the partners in the community. And so Dr. Ghani, who's the Chief Medical Officer at Magellan Health of Arizona, is going to share a little bit more about the initiative and some of what we've been up to. And I'd like to turn it over to Dr. Ghani.
Welcome, Dr. Ghani.
Thank you.
And one of the things you mentioned about peer support, what that means is that is a position for those of you who have had a serious mental illness or have went through a co-occurring disorder, that have now work in the field and are able to give back of what you've learned to somebody else. And what a great, awesome thing that is. Dr. Ghani, 75% of smokers have a past curative problem with mental illness. 44% of cigarettes in the U.S. are smoked. Have smoked, how did they put it, by people with serious mental illness. 2009, you guys joined forces with the Tobacco Free, as Tomas said. 2010, introduced that whole health peer support program, and along with that, different stuff with the clinics What's going on with the Chief Medical Officer? You guys are really kind of busting it out over there.
Good morning. Thank you for having me on the show. The initiatives that we've been talking about between Richard, Dr. Clarke, and Tomas, the premature death rates in individuals are the reasons behind that being suicides, chronic physical health conditions, and smoking. And the Magellan Health Services back in 2010 put together a health and wellness steering committee, which was put together with membership from the community, from representatives from the legislature, other thought leaders, Arizona Department of Health, ASU, and all these individuals have come together and working on pinpointing how do we make the improvements in our system to improve the health care provided to these individuals. We have been working on their behavioral health needs for years in silos from the primary care physician or physical health services that these individuals get. So one of the initiatives that was mentioned was the health risk assessment, and the 10,000 health risk assessments completed show a disparity of chronic health conditions. And for substance use or drug and alcohol disorders, 28% of individuals had a substance use disorder as compared to 16% of the general population in Arizona. For diabetes, 18% as compared to 8% in Arizona. Heart disease, 37% compared to 3% in individuals in Arizona in the general population. And obesity. Now, obesity is defined as a basal metabolic index. BMI is a score which is a comparison of the height and weight of an individual. Correct. It's a standardized score. 63% individuals with serious mental illness are dealing with obesity, as opposed to 25% of the general population in Arizona. I mean, right there it tells you what we are looking at.
And that complements that 1 in 4 type of aspect, really, that you guys are dealing with.
Absolutely. So you asked the question earlier in the show, the health risk assessments, with these, we are able to actually streamline the problem. We can understand the problem much better. You know, with that said, now we are launching into this integrated healthcare home, which is a partnership between our providers, People of Color Network being one of them, and Maricopa Integrated Health Services. So we are bringing together behavioral health and physical health. It's a integrated care team, which is behavioral health led. We are targeting, and we will be able to provide physical health services in the behavioral health clinics. One of the things our individuals, I call them, individuals with serious mental illness deal with is the stigma of mental illness. And due to the disorder itself, the symptoms, and inability sometimes to express one's symptoms. So bringing those two together, these individuals would be able to get better care. When these individuals are treated, we have medications coming in from the behavioral health side and medications from the primary care side, but it's one body that they're all going into. So focusing on drug and drug disease interactions. There are medications that inversely impact the outcomes of a behavioral health disorder and vice versa. So we are addressing those. With that said, we've designated 4 clinics as alpha sites. That is going first, and that's where the target is for these individuals to get their primary care services in the behavioral health clinic. We are starting what is called enhanced coordination with Maricopa Integrated Health Service physicians, where there is joint treatment planning between psychiatrists and nurse practitioners on the behavioral health side and primary care physicians and nurses on the medical side. Now, this is unheard of. Let me make that very clear, that this has not happened before at the level of 14,000 individuals with serious mental illness who are Medicaid eligible, and we are striving to provide all of them with this integrated service and treatment planning with the target of reducing this disparity of earlier, 27 years earlier, dying 27 years earlier than the general population.
And in that same category, you guys also have started or starting to build out in those alpha clinics those web portals where they can actually access information, or at least they're entertaining it according to this. We're viewing information, health information, where it makes it a little bit easier for that integration to occur instead of having everything so separate in different areas. That's got to be one heck of a task, being able to take the amount of people who need services in Arizona and being able to mix everybody together, as Dr. Clarke has talked about. It goes from the federal government to the state to Magellan, and then obviously out to the community. So that's a lot of integrated planning, a lot of integrated coordination and collaboration. What can local businesses, let me ask that question, what can local businesses, what can people in our valley do to complement the process for a better Phoenix? I mean, if we're going to live in Phoenix, we might as well bless it. You guys are doing a lot of work. You guys are doing a tremendous amount of work in that healthcare side. Dr. Clarke, what can somebody in the community that has influence, what can they do?
I think one of the most important things is to get involved. Get involved in organizations like People of Color Network and any of our 150 providers. Join their boards. Bring your expertise to the table. Having our high-tech industry in Arizona, which is phenomenal, become part of helping design and develop the solutions for the behavioral health field and for these integrated models. The system's going to change. It's going to learn. People with behavioral health issues could be any one of us. 1 in 4 adults suffers of mental illness. The person next to us. This is an everyday occurrence in our society. These are things that are treatable. They're understandable, and there are solutions for them. And getting involved, I think, is really important. I tell Tomas and other significant leaders in our community that a healthy behavioral health system generates a healthy economy.
There you go.
So if you're getting treatment, if you feel valued, if you have a job and you're contributing to the taxpayer base of the community, our whole society improves and our economy.
Dr. Ghani, one thing real quick, out about 15 seconds, if you could say one thing to the community, what would it be?
I think I would echo what Dr. Clarke said. Get involved and look at the IT solutions, and that's that.
Okay, Tomas, one thing real quick.
I think we just need to carry on that New Year's resolution and focus on your health and wellness. And what we can do together is focus on the whole person. And once we're focused on the whole person, then we can really make some transformation in terms of helping people get better and stay better.
And what you can do out in the community is you can call the numbers on your screen. You can get involved, as Dr. Richard Clarke had said. Somebody that comes with a boatload of experience from the American Psychological Association, being a member there, Research Evaluation Committee, California Alliance of Children and Family Services, and on and on and on. Go ahead and log on to aztv.com for more information. We'll see you next Sunday.